Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is aspiration pneumonia. So this is the third in our series on pneumonia, having previously covered community-acquired and hospital-acquired pneumonias, which can be found in our previous two videos. So aspiration pneumonia frequently results from several factors which essentially impair one's ability to swallow or increase the risk of choking episodes. So this can result from impaired consciousness, dysphagia, for example, following a stroke, airway obstruction, and chemical pneumonitis. Anaerobes are the commonest organisms, and this can also lead to pulmonary abscesses and empyemas. As with any pneumonia, the signs and symptoms to look out for are reduced chest expansion, reduced breath sounds on the infected side, dullness on percussion, and coarse crackles. It's more likely to have an aspiration pneumonia on the right-hand side lung due to the anatomy, meaning that it's more likely for aspiration to occur on this side. Poor swallow and reduced consciousness, as well as a cough, may also signal an aspiration pneumonia. Investigations include history, a thorough examination, observations including a temperature, as well as a GCS to check level of consciousness. It's important, as ever, to do a sputum sample and culture, as well as blood tests, including inflammatory markers and blood cultures. It's important to note that a chest X-ray may be normal, particularly at early stages of an aspiration pneumonia, and as we've already discussed, the right side is more commonly affected. The management of an aspiration pneumonia does require an MDT approach. A salt assessment is vital to check one's swallow, and a patient may need to be kept nil by mouth. It's important to convert critical drugs to alternative routes, so these include those such as anti-epileptics or Parkinson's medications. It's important to investigate the underlying cause, for example with a CT head scan, particularly where there is impaired conscious levels. The treatment is with broad-spectrum IV antibiotics with anaerobic cover. An example of this would be metronidazole. So now let's do a question. A 75-year-old man with a known history of motor neurone disease presents to the medical take with a 2-day history of confusion and pyrexia. The IMT1 doctor takes a collateral history from the patient's wife, who reports the patient has had choking episodes and swallowing difficulties over the past couple of days. On examination, he has a temperature of 39.5 degrees and right-sided inspiratory crackles. His chest X-ray is normal. Given the likely diagnosis, which of the following is incorrect? So our options are initiation of intravenous antibiotics is indicated, a medication reconciliation is indicated, aspiration pneumonia is unlikely given the normal chest X-ray, metronidazole would be the antibiotic of choice, a salt assessment is indicated. So the correct answer here is C, because the chest X-ray may be normal in the early stages of an aspiration pneumonia, which is the top differential diagnosis here. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.